Arturo here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Arturo. But today, I am not alone. Of course, Dr. Vidal is here. You all know her. She's been with us for about 2 years now. 2 years. Dr. Vidal has been super cool, super exciting. But now comes the big announcement, okay? Because Pure is growing. We just can't handle the capacity here anymore, so we gotta bring someone else in. So that's right. So today's a big day. We're gonna make the big announcement, and so you guys are gonna be able to meet our new surgeon. And of course, the reason we're doing it here live is because we want you guys to ask him all your yearning, burning questions. Okay? So you can ask him pretty much anything, whether you want to ask about background or also about what surgeries he likes, what he specializes in, etc. Okay? So, without further ado, drum roll please. Alright, our new surgeon at Pure Plastic Surgery is Dr. Garrett Wegerif. Alright, hello everybody. The only thing with Dr. Garrett here is that he's so big we barely fit in the camera.
Okay, I have to be honest. Yes.
So we may have to do a couple little camera adjustments here, but while we do that, I just want to say we're super excited to have you on board. I've actually known Garrett for quite a while. We first met back in Cleveland Clinic, Florida. So I was an attending plastic surgeon there, and Dr. Garrett here was a general surgery resident, correct? So that's where we met many years ago. Then of course, he went on to do his plastic surgery training. I'll let him tell you a little bit more about that. And then we just reconnected actually not too long ago, and so we're super excited to have him here. We know that he shares our values. Patient safety is #1 priority, and he's had great training, and we look forward to working together.
Awesome. Thank you for the welcome.
All right. So if you want, get a little introduction, that'd be great. But otherwise, we'll be taking questions from you guys. So let us know. What are you interested in? What do you want to know about the new doc?
What are the comments? I'm excited.
Oh God. I don't know. I think this is PG-13. I guess. So I love to be on his table one day.
There you go.
Okay.
Oh.
Okay.
Yay. Lisha said, guapo. Okay. Are you married?
Yes, I am.
Girls.
Yes, this is about plastic surgery.
Yeah, let's focus.
Okay, another one asking, yes, I'll be glad to be operated by him.
Okay,
That's good,
so
okay.
now you guys know where to go. You're going to go to our website, www.pureplasticsurgery.com, hit the virtual consultation button, and say, I want surgery with Dr. Wegerif.
Okay, another question. Can we nickname him Dr. Guapo? What do you say about that, Dr. Garrett?
Dr. Earl's gonna get a little jealous here, guys. Tone it down.
Okay, I'm the semaglutide now, so
Yeah.
I'm catching up. Okay.
Yes, Doug, just
All right.
a few more weeks.
Tell us a little bit about yourself, like in terms of.
Well, I have an actual question.
Okay.
Well, those were questions too, but this one says, are you board certified?
So I am a board certified general surgeon, and I'm a board eligible plastic and reconstructive surgeon. So a little bit about me. First of all, thank you for the warm welcome. I'm really excited to be getting started at Pure. I am a Florida native. I grew up in Cape Canaveral, Florida. I went to undergrad at the University of South Florida over in Tampa. And then I did my general surgery training down here in Cleveland Clinic, Florida, and that's where I met Dr. Earl.
Right.
And first really got my interest in plastic surgery, and then I went out to the University of New Mexico in Albuquerque to do my plastic surgery training. So completed that in 2022, and I'm currently in the board collection period, and so board certified general surgeon, board eligible plastic surgeon.
Right, so how many years of training has that been so far?
I did 9 years of training after medical school.
That's
Yes.
right. So lots and lots of training. He went kind of the long track, similar track to what we did as well. So we are actually all fully board certified general surgeons because we all did general surgery first and then went on to continue to do further training, specifically in plastic and reconstructive surgery. And we've talked about this before in terms of like what are all the steps you have to take in order to be board certified. So, and we've all had to go through these steps. So I don't know if you recall, but when Dr. Vidal started with us, she was also board eligible because what happens is that when you graduate from a plastics program, right, you can't get your board certification right away. You have to take your written exam, you have to take your oral exam, but in between that, you have to do what's called a
Board collection,
yes, board collection or case collection period.
Fun
so,
times.
Yes, and that the amount of time that you take doing that is really determined by the board. So it takes at least a year and a half, sometimes longer. You have to collect a certain number of cases that have to be done. There can be different categories and whatnot, and only then can you then apply for your boards.
Your oral board. So I've already taken my written boards and passed that, and so now I'm just in the final phase of the certification process.
Correct.
Okay, this question could be answered by any of you doctors, and if you do round 2 for BBLs, even though the first one isn't your work.
Yeah. So what are your thoughts on that?
I honestly prefer not to do a round 2. I think, my personal opinion, their scar tissue forms from the first round and it can make the results a little unpredictable for the second round. So only very select patients, or if it was someone that I previously operated on that I needed to touch up a little bit, that would be a time to do a second round for myself.
Your preference there? Yeah.
Yeah. I take it a case-by-case basis. I think it's very important to determine what are your goals, to see if we can achieve those goals. What was done in the previous round, and sometimes it's not just reduction with liposuction, sometimes it involves removing excess skin. So there are some things that we have to evaluate, so I take it a case-by-case and decide if you're a good candidate and determine if I can help you achieve those goals.
Yeah, so I agree with that, but I'm probably a little bit one of the people here, a little bit maybe more willing to take a round 2, but they are definitely challenging cases. They have to be taken on a case-by-case basis. But what I've been seeing a lot lately is also people wanting to kind of reverse their BBLs or change their shape, and so that's actually something that I've been focusing on in the last few months. We're seeing more and more of that because prior BBLs were not taking the patient's shape into consideration, their underlying foundation, and so they're having like hips that are way too wide or buttocks that are way too big, and so now we're seeing a lot of people kind of wanting to reverse that. Of course, like almost everything in plastic surgery, a lot of that started with Kim K as well. She went too big and now she wants to go smaller, and then a lot of people are following that trend. So we're seeing that grow, recently as well.
Okay, this is for Dr. Wegerif. What's your favorite procedure to work on?
All right.
This is a great question, and I really enjoy doing mommy makeovers. I think they're just one of the most rewarding procedures you can do because having a child is a beautiful thing, and then when women lose their confidence after that during the postpartum period, being able to help them regain that is really an awesome thing. That's my procedure.
All right, and just so to be specific, sometimes it can be confusing. When you say mommy makeover,
that's usually any combination of a breast procedure with an abdominal procedure. So typically an abdominoplasty with either a breast aug or a breast lift and aug, depending on what the patient needs.
Exactly. So that's what we typically mean here at Pure Plastic Surgery when we talk about mommy makeovers, is a breast procedure and a tummy tuck. Because I know there can be some confusion out there. This kind of uses a general term. Some people kind of throw in a BBL in there. We don't do that here. So one of the things that we liked about Dr. Garrett here is that he's very, very aligned with our safety protocols here. Okay, so we want to separate for example BBLs and tummy tucks or mommy makeovers because first of all, I don't think you're gonna get a great result. Recovery is going to be very, very tough, but it's also less safe to combine all those procedures in one.
Okay, Dr. Earl, as you are the CEO of the clinic, there are any introductory prices? There are any specials going on?
Yeah, of course.
Question.
Yeah, of course. So, yeah, you got a call? No. So there are going to be, of course, and we, like we did with Dr. Vidal when she first started, and what I did with myself when I opened up here. There's always going to be some introductory kind of specials going on. So I don't have details right now, so you guys are gonna have to stay tuned, okay? But yes, those are gonna be coming up in the next few weeks or so.
Yes, okay, more. I have
All right.
a ton of questions. Dr. Garrett, Dr. Wegerif, I'm sorry. There's any IG account to see your work?
Yes, there is. Dr.Garrett.Wegerif, and we'll put a link to that, I'm sure, at the end of this.
Yes, exactly.
Yeah.
So, yeah, definitely you guys are going to want to check that out. And of course, we're going to be continuing to build upon that. But yeah, definitely go to his IG. You can see some of his work. He'll probably be doing some lives, some stories, etc. So you'll be able to get to know him, past today, of course. Because one of the things that we really like to do, there's two main points to our social media, right? One is patient education, which is really paramount, is most important. But the other one is to get to know us, right? To get to know what we're all about. So you guys have seen a lot of Dr. Vidal's IG, and she has the baby and all that, and so you get to know her. And then right now you know nothing about Dr. Wegerif here.
You guys can watch me
So-
struggle through
There you
my
go.
social media anxiety and get on TikTok, and it's going to be traumatizing for me.
All right, there you go.
There you go.
There you go.
Okay, give me just 1 second, doctors, please. I need another hand for today. I don't want. Okay, doctor, there's any special procedure that you perform here at Pure?
All right.
For me?
Yes.
All right.
It's all about you.
So I think one of my unique procedures that I perform that Dr. Earl or Dr. Vidal does not do is a drainless abdominoplasty. And so that's something I had training with out in New Mexico, and I've carried back here, and I think it's a great procedure. A lot of patients have anxiety about having drains, and so being able to eliminate drains for their abdominoplasty tends to help a lot of patients out with that.
Okay, Dr.
Yeah.
Wegerif, the next question is.
So
Sorry.
just to talk about that. So yeah, so one of the great things about bringing another surgeon to the practice is that we can expand the services that we provide, and therefore there are more options for you, which is great. So for example, when Dr. Vidal came along, she was she does a lot of things that I kind of stopped doing. She'll do a lot more of the facial work. She'll do rhinoplasty. She'll do labioplasty. And things of that nature. And now, with Dr. Garrett here, we're going to be offering drainless tummy tucks, as probably as well as some other procedures that I've kind of shied away from or whatnot.
Yep.
Okay, when will you begin taking patients?
I believe we're going to start seeing consults on the 21st, and then
Of this month.
of
Yes.
this month.
Yeah.
And then cases will begin shortly after that. I don't think we have a solid date on that yet, but probably early September or end of October or August.
Yes, so definitely consults can start coming in as soon as I believe that's next week or one and a half weeks. And then actual surgery will be early September.
Okay, let's keep with the questions. I have a lot. Well, if we are saving this, yes, this will be posted on Dr. Earl's feed. We're excited to have Dr. Wegerif join in the Pure family.
Yeah.
So welcome, Doctor.
Thank you.
Let's keep. If someone can tag his IG account, don't worry, I'll do it
Okay.
later.
Well, the man behind the camera. Yes, that's right. So yeah, no, we're gonna make sure that you guys get that information. We'll tag them on certainly on my IG so that where you know where to look, so you can go there and find it and find everything.
Okay, this is for Dr. Wegerif, and if he can talk about his criteria for patients' age and BMI, please.
Yes. All right.
Absolutely.
Yeah.
For age, I really don't have a strict cutoff. If you're healthy and a good surgical candidate, I'll do you up to 70 years old. If it's anything beyond that, it would need to be done in a hospital. BMI requirements, for liposuction only procedures, if you're the proper candidate for it, I will go up to BMI of 35. For any procedure that requires cutting, so any breast or abdominoplasty procedure, it's going to be BMI of 33.5.
Okay. So yeah, so each of us have our own criteria. They do differ a little bit. Okay. So that's part of like the get to know you process. So Dr. Wegerif will have his own criteria as well, and these can evolve over time also. But yes, so things are maybe a little bit different. So necessarily, say that you didn't qualify in terms of my criteria, that doesn't mean that you don't qualify for pure plastic surgery. Okay, so I wanted you guys to keep that in mind because there are again more surgeons, more options, and more options in terms of dates. Right, we have a whole bunch of dates now, pretty much opened up.
Perfect.
So don't worry about that. You're not gonna have to wait months and months and months. And of course, differences in criteria as well. So that's going to be a big thing for you guys.
This is for Dr. Earl, and they ask, how was the training in Colombia?
Oh, yes.
Good question.
Training was awesome. It was really good. Actually, I was, I had a great time. I learned a lot. And I'm going to be talking about that in my next live, okay? So I'm going to be giving a lot of details next Wednesday, all right, our next hump day. But just know that, yes, I'm super excited about it. I'm really, wanting to bring that whole Colombian high-def or HD experience here to Miami. There really isn't a lot of that here, and so we're going to be doing that, but and this is key. Not just for women, but for guys too, okay? So yes, so I'm bringing that whole HD. That means, we're gonna be etching out the abs, the pecs, the arms. So we're gonna be bringing all that here to Miami as well.
Okay, welcome to the team, Dr. Wegerif.
Thank you.
Okay, somebody's interested in the Colombian definition. I gotta get that.
Yes.
Okay, one more question. Is a BBL safe long term?
All right. Who's that for? Wanna take it?
In the right hands? Yeah, absolutely.
Yeah, Dr. Vidal,
Yeah.
your thoughts on that?
Absolutely. The safety of the BBL, it's mainly like in the operative time and also in the early post-op period. That's when we can see fat embolism, and that's why it's so important to use the ultrasound to visualize where we're injecting the fat. Then risk of infection is really those first few days to 2 weeks early post-op period after the surgery. Long term, the risk of the surgery decrease, but then you have to maintain your results, right? With time, then you have skin elasticity problems, the fat changes, your body distribution changes. So maintaining a healthy diet, exercise is super important to try to maintain those results long term.
Great. Give me just 1 second, dogs, please. And let's go to the other question. How is it important? I think we have almost everything covered except what about breast surgery revision? That's for Dr. Wegerif, if you do that.
Absolutely. Yeah, I do a lot of breast revision, did a lot of breast reconstruction during training, and I feel comfortable doing revisions, so they're procedures I enjoy a lot.
And how about internal bra
Absolutely.
mesh?
We use that Galaflex mesh for right candidates. Definitely one of the tools in the toolbox.
Excellent. So yeah, one of the great things about coming out from your plastic surgery training is that you do a lot of breast reconstruction there. So a lot of those things can be applied to aesthetics as well. So if you had a prior breast surgery and things didn't go right, or there's been a lot of body changes since then, that's something that certainly we can tackle.
Okay, is there a BMI limit for brachioplasty?
For brachioplasty, it would be, for me, it would be less than 33.5.
Yeah. All
For
right.
you?
No.
No?
So for me, my max BMI for everything is 30. So I'm definitely the most restricted. But I believe Dr. Vidal is 33.5
as well. Correct.
So yeah. So you have options there as well. Okay.
Okay.
All
Dr.
right.
Earl, you're the goat.
Yeah.
With the
all
goat.
right. Thank you. Awesome. And I can't wait to tell you guys about Colombia as well. So definitely stay tuned for that. But today was all about Dr. Garrett here. Once again, super excited to have him on board. You guys are going to be learning a lot about him in the next few weeks. All right, so make sure you check it out. We'll definitely send you all the links Okay, and yeah, consults start in about a week and a half or so.
Awesome. Look forward to
Okay.
meeting everyone. Thank you.
You know what, Dr. Earl? This is a really important question just came in. I think that's important. What made you choose him to be part of your practice? I love that question. Yes.
Yes. All right.
Question.
So, really, when we're choosing a surgeon here, it's really about the right fit, okay? And what I mean about that is not only, how they, whether they jive with the way that we want to treat our patients and all our safety protocols, but also how we believe they're going to get along with all our staff, okay? As you guys know, we have a very much of a family-like feel here at Pure Plastic Surgery, not just with the patients, but also with the staff and everybody that's working here. So we need someone that's going to be kind of, just truly form a part of that family. So I think that's, what, having known Garrett, from a few years back, and then kind of getting in touch again, knowing that he's a, family person himself, and then just the way this attitude, the way that he treats people, patients, staff, and everybody else, and the fact that he's so focused, on patient safety first, all those things kind of came together. And to be honest, we weren't even thinking about adding a new surgeon until we kind of reconnected and all that came together, and we thought it'd be a perfect fit for us.
Awesome. Thank you.
All right. All right, everybody. So that's it for today. Stay tuned for next week. We're going to talk about Colombian HD lipo then. Okay. But otherwise, go to all our IGs. Now we have a bunch of them, right? Now we got plastics, we got Dr. Vidal, Dr. Garrett, everybody. All right. It's all super exciting. Okay. But we'll send you all the links and we'll catch you all next week. Ciao.
Good one.